In Florida, more than 580,000 people aged 65 or older live with Alzheimer's. Our state has the second largest Alzheimer's population in the U.S. Alzheimer and dementia don't just impact the individual, of course, but has also caused a hefty burden for caregivers. To help us understand more about the disease, we are joined now by Dr. Carl V. Hill, the Chief Diversity, Equity, and Inclusion Officer for the Alzheimer's Association. Dr. Hill, thank you so much for joining us.
Thank you for having me. Excited to be with you today.
So I do want to talk about the good news in Alzheimer's research and treatment. But first, I want to start with, in the past 30 years, there has been a nearly 150% increase in Alzheimer and dementia diagnosis. How concerning is that? Or is that good news in that we are diagnosing more people, or are the cases actually increasing?
I tell you, it's bittersweet in the sense that diagnosis is happening, but more than for the first time, this year we reported more than 7 million Americans are living with Alzheimer's, and as you mentioned, that's the over 550,000 people in Florida, which represents 12.5% of all people aged 65 years and older living in the state, in Florida. And so we need to lessen that number of all people who are living with Alzheimer's, all of the numbers of caregivers who are doing heroic work. Mm-hmm. We've got to really address this public health crisis.
So in terms of, there is some positive news in terms of diagnosing and treatment. I know there's a lot of excitement about a blood detection test and about some new medications potentially coming up the pipeline. What do you want folks to know about how significant this progress is in diagnosing and treating?
Well, I'll tell you three really important pieces here. First is what the research is telling us more and more, what's good for the heart is good for the brain, right? And there's the identification of what we call modifiable risk factors. And so we know, genetics play a role here, family history, plays a role here. Those are things, and age, are risk factors. Those are things that, you can't change, right? But research is saying, 45% of dementia cases, Alzheimer's and other dementia cases, may be attributable to things like controlling blood pressure or, physical activity. So adopting, healthy behaviors like exercising, eating right, getting good quality sleep, controlling, blood pressure can improve brain health. So there's a public health risk reduction perspective that people need to know and things that they can do. Another one, the second one here, is the availability of what we call disease-modifying treatments that slow the cognitive decline. They're not cures, but they give people more time to be potentially at early stage Alzheimer's, or to have more time in planning their care. So this is amazing, great breakthroughs in this research. And then just a couple of weeks ago, as you know, the first ever blood test, FDA approved blood test for diagnosing Alzheimer's was announced. And we're encouraged, because it will help enable earlier diagnosis. It's even more reason to know the signs of Alzheimer's so you can have that conversation with a doctor and get a timely diagnosis as soon as possible.
You mentioned to me earlier that you want to get the message out that dementia is not just a normal part of aging. So what is your message to anyone out there who has concerns maybe about themselves or about somebody in the family?
That you've got to visit our new resource, our collaboration with the Ad Council. We created 10signs.org, the number 10 and then signs.org. And it's an excellent tool to be updated on, what some of the warning signs, the signs of Alzheimer's and dementia, and how they may differ from typical age-related changes. So signs of Alzheimer's, losing track of the date or the season, routinely, having poor judgment and decision making, or misplacing things and being unable to retrace, steps to find them, versus, typical age-related changes, losing your key from time to time, making a bad decision once in a while. People need resources to be able to notice the difference, between, these types of changes. And so, 10signs.org, great resource for people to go and be updated, so that if there are concerns about Alzheimer's or another dementia, people can have the tools to have a conversation with a doctor about what they've been experiencing. And this could lead to treatment, and certainly proper care and support.
Dr. Hill, we thank you so much for your time. Thank you.
Thank you so much.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.